Hello.
Hi.
Hi, is it Tom Saul?
Yes.
Hi, my name's Janet. I'm one of the third year medical students working in the hospital today. Would it be okay if I spoke to you and did an exam of your legs?
Yeah, that's fine.
Yeah? Can I start by confirming your name, please?
Yes, Tom Saul.
And your age?
I'm 55.
Okay. I understand you've come in with some leg pain today, is that right?
That's right, yeah.
Yeah, how long has that been going on for?
A couple of months now.
Yeah?
Yeah.
Is it on and off as well?
It's mainly when I kind of exercise or when I'm exerting myself.
Okay, so how far do you have to walk before you do get this pain?
About 100 metres, I'd say.
Yeah? And are you able to walk through the pain?
I haven't really tried, to be honest.
Okay, that's fine. And what do you do to relieve the pain? What can you do?
If I just stop and sit down or relax, and then it tends to relieve it.
And it seems to go?
Mm-hmm.
Okay. And you've never had this pain before?
No.
No? Okay. Do you ever get this pain at rest?
No, not that I can think of.
But when you're sleeping?
No.
No. Okay. And is it just in the calves you get this pain?
Yeah.
You don't get it in the thighs or the buttocks?
No.
No. Okay. Have you ever had any medical conditions related to your heart before?
No.
No? High blood pressure?
No.
Cholesterol?
No.
And do you have diabetes?
I don't.
Okay. Do you smoke?
I do smoke, yeah, about 10 a day.
About 10 a day. And how long have you been smoking 10 a day for now?
20 years now.
20 years. Okay. And do you drink any alcohol?
No.
No. Okay. Is there any family history of these conditions that we've spoken about?
I don't believe so.
Okay. What I'd like to do now is move on to the examination.
Mm-hmm.
Is it okay with you if I ask you to remove your shorts and you can keep your underwear on? Is that okay?
Yeah.
Yeah? Perfect. Thank you. So, if you don't mind standing up for me.
Mm-hmm.
Okay. So I'm just having a good look at the legs. Do you mind facing that wall over there for me? So having a look at the back as well. Okay. Do you want to lie down? Is it okay with you if I talk to my colleague as I go through the exam?
Yeah, that's fine.
So on inspection, I didn't notice any hair loss. The skin looks normal. There was no shiny skin. There were no obvious ulcers. And there was no signs of venous insufficiency on standing. I'm just going to have a look in between your toes as well, if that's okay.
Mm-hmm.
Okay. There are no small arterial ulcers either. I'm looking at the soles of the feet. Again, no soles or ulcers at the soles of the feet. Okay. What I'm going to do is just have a squeeze of the toes as well.
Mm-hmm.
That's okay. Do you have any pain in the leg?
Not right now.
Okay. And so cap refill, so I was holding down for 5 seconds and cap refill time was less than 2 seconds. I'm just going to have a feel of the temperature of the legs now.
Mm-hmm.
So I'm comparing both sides. So the temperature is normal and consistent throughout. Would it be okay if I just lie you flat?
Yeah, that's fine.
Do you mind just pulling up your top so I can have a look at your abdomen? Do you have any pain in the tummy area?
No.
No. Just going to have a feel here. Okay. The abdominal aorta is pulsatile but not expansor. You can pull your top back down now. I'm just going to have a listen to some of your pulses as well, if that's okay.
Yeah.
So, I'll gently do it. Okay, I'm just going to do the other side as well. Okay, and again, do you mind lifting up your t-shirt for me? Okay, there were no abdominal aortic bruits or renal bruits. No bruits in the femoral arteries either. Okay. Do you have any pain in your hips or any discomfort in your hips at the moment?
No.
What I'd like to do is just lift the leg up, and after a while, I'm going to ask you to swing both legs round and just sit on the edge of the bed if that's okay.
That's fine.
Okay. So just relax for me and let me do the work. So I'm looking for any colour change within the leg. And there is no colour change. Ideally, I'd do this all the way up to 90 degrees. Would you be able to swing both legs around the side for me? Okay. Now, as there was no colour change, then there is no delay in the colour returning, and there's no reactive hyperemia. Would you like to lie that down? If we could do that again on the other leg. So again, any pain or hip in that hip there?
No.
Okay. Okay, ideally I'll do this to 90 degrees. Do you want to swing both legs round? Again, there was no colour change on elevation of the leg, and there was no reactive hyperemia here. Thank you very much. Would you like any help getting your changed again?
No, that's
No?
fine.
Okay, well thank you very much for your time. I'm just going to talk to my colleague now.
Mm-hmm.
Thank you. I performed an arterial examination on Mr. Tom Sal, 55-year-old male. He's complaining of 2-month history of intermittent claudication without pain on rest. On examination, there were no positive findings indicative of any arterial disease. However, to complete my examination, I would like to start with a full history, a full cardiovascular exam, looking specifically at the blood pressure and the pulses in the radial pulse and the carotid pulse. I would also like to do a full neurological examination of both legs. By the bedside, I would like to do an ECG, as well as measuring the patient's ankle brachial pressure index. And I would like to end the examination with an ultrasound Doppler, a duplex ultrasound of both legs.